Hi everyone, Rachel here coming live to you from my kitchen. I'm just here to chat about what advanced directives are and what they look like in Vermont, and how people can go about the process so that we as primary care providers can help walk people through it. So an advanced directive is a legal document that outlines your preferences for medical treatment if you're unable to communicate your wishes. This includes critical decisions such as life-sustaining treatments, resuscitation, and other forms of care, whether you want that or not, whether you want parts of that or not, kind of what you want that to look like for yourself. In Vermont, there are two main types of advanced directives, a living will and a durable power of attorney for healthcare. So let's dive deeper and kind of discuss the differences. The living will is a document that allows you to specify the types of medical treatment you would or would not want at the end of your life. For example, you can express your wishes regarding mechanical ventilation or feeding tubes, and it really ensures that your values and preferences guide your care when you can't speak for yourself. On the other hand, the durable power of attorney for healthcare allows you to appoint someone you trust to make healthcare decisions on your behalf when you become unable to do so. And choosing the right person is really important because it should be someone who understands your values and can advocate for your wishes. This really comes into play when we encounter situations that might not be completely outlined in the living will. So why is this important? Having an advanced directive is more than just paperwork. It really provides clarity and guidance to medical professionals during some of the most challenging moments a person and a family might experience. Without these clear directives, healthcare providers might struggle to make decisions that reflect what you want and what your values are. It alleviates the emotional burden on family members as well. Imagine being your loved ones facing the stress of making life and death decisions without knowing what you really would have wanted. An advanced directive helps avoid this uncertainty, allowing your family to focus on supporting you rather than making tough choices. So let's walk through how you can create your own advanced directive in Vermont. The first step is to reflect on your values and take time to really think about what matters most and your end of life and healthcare wishes. This would include your beliefs, experiences, and the kind of care that you would want. Step 2 would be to choose an agent. If you're creating a durable power of attorney, select someone you trust, and this person should be able to advocate for you and really understand your values. You should discuss this with that person beforehand. Step 3 is to use Vermont's forms. You can find these forms on the Vermont Secretary of State's website and through healthcare providers such as your primary care provider. And they're pretty user-friendly, but it's important to read them carefully and fill them out carefully as well. 4 is to discuss your wishes, having open conversations with your family and your chosen healthcare agent about your choices. This dialogue really ensures that everyone understands what your wishes are and can support them. And while they are your wishes, it's important to try your best to not surprise your family members in these situations. Step 5 is to sign and witness. After completing your documents, sign them in front of a witness as required by Vermont law, and make sure your witnesses are not your appointed agents or immediate family members to avoid any conflicts of interest. And then keep copies. So keep copies in a safe place, share with your healthcare provider, share with your family members, so that it's accessible when it's needed. Once you've completed your advanced directive, it's a good idea to revisit it periodically as your life circumstances change, your health, your values, your relationships. Regularly viewing your advanced directive ensures that it still aligns with your current wishes. And also, it's important to remember that these aren't just for the elderly or those facing serious illnesses. They're for anyone who really wants to ensure their healthcare preferences are respected, regardless of age and health status. And so that's pretty much the summary of advanced directives, and it's really important for us as future healthcare providers and possibly primary care providers to understand this process and be able to help walk patients through it, and also to kind of practice what we preach and have these discussions with our family members, with ourselves, and like try and figure out what our values are and what we would want based on our experiences. Thanks.